Nursing Care of Substance Use and Addictive Disorders. Module 1, Foundations and Neurobiology of Addiction. Addiction is not a moral failure. It is not a lack of willpower, and it is not simply bad decision-making. Addiction is a chronic brain condition that changes how the brain processes reward, stress, and impulse control. As nurses, our job is not to judge. Our job is to assess, stabilize, educate, and support recovery. In this module, we are going to build the foundation so that you understand what is happening in the brain and why that matters for patient care. Substance use disorder develops when repeated use of a substance changes the brain's reward system. What may begin as voluntary use slowly becomes compulsive. The brain starts to associate the substance with survival-level reward. Over time, control shifts away from the part of the brain responsible for judgment and decision-making, the prefrontal cortex, and toward deeper reward pathways. This is why patients may continue using substances even when it is harming their health, relationships, or employment. It is not simply about making better choices. It is about brain changes. Substance use disorder exists on a spectrum. It can be mild, moderate, or severe depending on how many behavioral criteria are present. Severity can change over time. Addiction follows a repeating cycle. Stage 1, binge or intoxication. The person uses the substance. Dopamine increases. The brain links the substance with pleasure. Environmental cues, certain people, places, or emotions begin triggering desire. Stage 2, withdrawal or negative feelings. When the substance is stopped, the person may feel anxious, irritable, depressed, restless, or physically uncomfortable. The brain's stress system becomes activated. Now the substance is no longer just about pleasure. It becomes about relief. Stage 3, craving and preoccupation. Impulse control weakens. Cravings increase. Stress or reminders of past use can trigger intense desire. This cycle repeats. Over time, it becomes stronger and more automatic. This helps explain why relapse can occur. It is not weakness. It is how the brain has been conditioned. This is very important for nursing students. Tolerance and physical dependence are not the same thing as addiction. Tolerance means a person needs more of a substance to get the same effect. Physical dependence means the body has adapted to the substance. If the substance is stopped, withdrawal symptoms occur. These can happen even when medications are prescribed appropriately, such as opioids for severe pain. That alone does not mean addiction. Addiction or substance use disorder is defined by behavior, craving, loss of control, continued use despite harm, and compulsive use. For NCLEX preparation and for safe clinical practice, it is important to clearly distinguish between intoxication, withdrawal, and substance use disorder. Intoxication refers to the effects that occur while a person is actively using a substance. Withdrawal refers to the rebound physical and psychological symptoms that occur after the substance is reduced or stopped. Substance use disorder, however, is a behavioral condition characterized by loss of control, craving, and continued use despite harmful consequences. Some withdrawal syndromes may be uncomfortable but not dangerous. Others, particularly alcohol and benzodiazepine withdrawal, can become life-threatening and require immediate medical monitoring and intervention. Substances affect the brain in predictable ways. Depressants like alcohol and benzodiazepines slow the central nervous system. Opioids slow breathing and reduce pain perception. Stimulants increase heart rate, blood pressure, and alertness. Cannabis affects perception and concentration. Hallucinogens distort sensory experience. As nurses, understanding these patterns helps you anticipate what you are seeing clinically. If someone has slow respirations and pinpoint pupils, think opioid intoxication. If someone is tremulous, hypertensive, and agitated after stopping alcohol, think withdrawal. Substance use does not happen in isolation. Risk factors include trauma, chronic stress, family history, untreated depression or anxiety, environmental instability, early exposure. Many individuals use substances as a way to cope with emotional pain. As nurses, this means we look beyond the substance. We assess mood, We assess trauma history. We assess coping skills. We assess safety. We practice trauma-informed care, meaning we assume many patients have experienced trauma and we approach them with sensitivity and respect. Language matters. Avoid terms like addict or abuser. Use person-first language. Person with substance use disorder. Many patients with substance use disorders have experienced stigma in healthcare settings. Judgment pushes patients away from care. Therapeutic nursing presence includes calm tone, clear boundaries, non-judgmental approach, consistent structure. Compassion does not mean ignoring boundaries. It means providing structured, evidence-based care with dignity. When you are assessing a patient with suspected substance use, when was the last use? What substance was used? Is the patient at risk for withdrawal? Assess airway, breathing, circulation, screen for suicide risk, assess for co-occurring mental health concerns. Evaluate safety risks. Safety always comes first. Airway first, then stabilization, then long-term planning. Assessment should not delay urgent treatment. If a patient is in withdrawal or suicidal, you address that immediately. Addiction changes the brain, but recovery is possible. Substance use disorder is a chronic condition that requires long-term support, much like diabetes or hypertension. Understanding the neurobiology helps you approach patients with science instead of stigma. In the next module, we will focus specifically on alcohol use disorder, including intoxication, withdrawal, and nursing management priorities.